Okay, Paul, we're now live. You can go ahead.
Okay, well, good afternoon and thank you all for joining us today. I'm Paul Gullickson, Communications Manager for the County of Sonoma, and welcome to our COVID update for Wednesday, December 8th. Let's begin, as always, with a brief message from Gilbert Martinez from our communications team for our Spanish-speaking viewers. Gilbert?
Buenas noches y bienvenidos a la sesión informativa. Esta sesión informativa se está transmitiendo en vivo por nuestro canal de YouTube con la interpretación al español. Para escuchar la versión en español, puede usar el link de YouTube que se encuentra en la página de Facebook del Condado de Sonoma. Gracias. Y ahora regresamos para atrás con Paul Gullickson.
Thank you, Gilbert. So here in Sonoma County, we continue to make great strides in getting shots into arms and protecting people from the virus, thanks in large part to all our community partners, including our schools and the Sonoma County Office of Education. As of today, we've reached two key milestones in recent days. Our eligible population, age 5 and older, is now roughly 75% fully vaccinated, while the newest eligible demographic, those ages 5 to 11, are now 26% partially vaccinated, and many of those children are now getting their second doses. So we're encouraged by that. Meanwhile, we continue to monitor news about the Omicron variant. We still have not found any confirmed Omicron cases in Sonoma County so far, although several other counties and around 24 states have reported cases. Given the rapid spread of Omicron just in the past week, we do fully expect to detect it here in our county in the near future. As we discussed last week, we are doing genome sequencing on just about all positive cases here in Sonoma County, and we are able to see which variants are evident. There's still a lot that we do not know about this new variant. We need to be clear about that. We know that it seems to be highly transmissible, as evidenced by the rapid spread of the variant in South Africa and some other countries. But we are encouraged by early reports that from South Africa that seem to indicate the variant, while being more contagious than previous variants, may not be as severe as older versions, including the other versions, including the Delta variant. However, it's way too early to say for sure at this point, and we are at least a few weeks away from getting any definitive data, as Dr. Mace and Dr. Shende will talk about in a moment. What we do know is that getting vaccinated, including getting your boosters, remains the safest thing that you can do to protect yourself, your families, and your community. And it's an important step to take in anticipation of all that may be coming this holiday season. So now I'd like to just turn it over to Dr. Sundari Mace, Sonoma County's Health Officer. Dr. Mace?
Great, thank you so much, Paul. We are still learning more about the Omicron variant, including its transmissibility, clinical presentation, disease severity, risk of infection, and phenotypic impact on diagnostics. For now, we are continuing to fight the Delta variant, the dominant strain in our community. The best thing you can do is to get a COVID vaccine if you haven't already. If you're already vaccinated, get a booster shot, which is available to anyone 18 and older. Some new data suggests that getting a booster shot is actually going to be really helpful, even against the Omicron variant. So absolutely get your first dose if you haven't gotten a vaccine at all, your second dose if you're awaiting the second dose, and a booster shot if you're eligible at this time. I think we'll be in a better place if everybody can do this. We may be starting now to see a bump in cases as a result of Thanksgiving gatherings. More information to follow. We're tracking the numbers very closely. Our case rate is trending slightly upward at the moment, like the rest of the Bay Area. Now I'm going to turn this over to our lead epidemiologist, Kate Pack, who's going to run through some data slides and show you where we're going.
Thank you, Dr. Mace. I'll pull up some slides. Okay, so looking at our current data, as of today, we have 9.5 new cases per 100,000 residents. Our testing positivity overall in the county, as well as in the lowest quartile of the Healthy Places Index. So there's those areas of the county where residents have less access to resources to support their health and well-being. In both the overall county and in the lowest quartile, we're seeing about 3.5% test positivity. Our hospitalizations are remaining steady at about 20 individuals hospitalized per day with COVID-19. And looking since July, when we first began seeing the Delta variant in Sonoma County and experienced the surge, 94 people have died from COVID-19 complications. And to reiterate some of what Paul and Dr. Mays touched on around the Omicron variant, we know that Omicron is now the dominant variant circulating in South Africa, and it's been detected in over 50 countries in at least 20 states within the United States. In California, so far 9 cases have been detected, including 6 in the Bay Area. And that's in Alameda and in San Francisco. The variant has also been detected in wastewater in Sacramento and Merced counties. While research is still underway, there are some initial findings. Some findings suggest the variant may have reduced disease severity, although this is still being investigated. And Pfizer released some data suggesting that booster shots, so the 3rd dose, may offer protection against Omicron. And their initial studies were finding that the initial 2-dose series may not be sufficient to help protect against infection from Omicron. But when individuals have that 3rd dose, the protection seems to increase to a level that's sufficient. And as was noted, we do have the capacity within Sonoma County to detect Omicron when it does appear in our county. So far, we have not found cases. We will be tracking any Omicron variants along with all other variants sequenced on our data dashboard. CDC has listed Omicron as a variant of concern. The categories that we list on our dashboard are in accordance with CDC. So we will be adding Omicron to our tracking of variants tomorrow. But to reiterate, so far we have 0 cases. Looking at our case rate in 2020, shown here with the blue line, and our case rate in 2021, shown here with the red line, you can see that our current case rates are lower than what we saw at the same time last year in 2020. With colder weather and the start of the holiday season, prompting more indoor activities and gatherings, the transmission of COVID-19 may increase. And as Dr. Mays mentioned, we are starting to see a very slight uptick here that we don't know if will become a trend or not. The degree to which 2021 trends are going to mirror what we saw in 2020 is going to depend on several factors, including vaccination rates, variant transmissibility, and also the effectiveness of boosters and how many individuals get their boosters. When we look across California and in the Bay Area, we are seeing increased transmission currently. So this purple line shown here is the Bay Area. This blue line is California overall. And so we are seeing increased transmission currently. And Marin, which currently has the highest case rate among local Bay Area counties, however, has not observed a parallel increase in hospitalizations. So while their transmission is increasing, they aren't seeing the same adverse outcomes in terms of hospitalizations and deaths yet. And this is likely due to the majority of their residents, as well as their COVID cases, being fully vaccinated and having that additional protection. Nearly 86% of Marin's total population 0+ is fully vaccinated. Sonoma County is currently at 70.7% of the population fully vaccinated. And looking at Sonoma County's data, you can see those protective effects of vaccine. So this data is based on the past 90 days for cases and hospitalizations, and on data from January to present for deaths. And when we look at that data, we find that people who are unvaccinated are 9.3 times more likely to be infected with COVID-19, over 40 times more likely to be hospitalized with COVID-19 complications, and 16 times more likely to die from COVID-19 related illnesses. Looking at our vaccine administration, 74% of the population 5+, so those who are currently vaccine eligible, are fully vaccinated. And you can see here in terms of the trends by week in vaccine administration, we have seen an increase in doses being administered with the opening of eligibility to the 5 to 11-year-old age group, as well as individuals getting their booster doses. Looking at proportion vaccinated by age group, as Paul noted, over a quarter of the 5 to 11-year-olds are now at least partially vaccinated. Looking by race ethnicity, we continue to see disparities by racial ethnic groups. So if we look at Latinx, here we can see that 62.3% are fully vaccinated as compared to 70.7% for white non-Hispanic. We also see lower vaccination rates for multiracial, as well as American Indian, Alaskan Native. Looking at booster dose administration, to interpret these bars, the orange here indicates individuals who are eligible to receive their booster doses, and the blue is indicating individuals who were eligible and did receive their booster doses. So this is 65+, 50 to 64, and 18 to 49-year-olds. Looking at the 65+ group, who's most vulnerable to complications from COVID-19, 63% of eligible 65+-year-olds have received a booster dose so far in Sonoma County. Looking at our booster dose equity metrics, we can see in the lowest quartile of the Healthy Places Index, where individuals have the least access to resources to support health and well-being, 57.1% of 65+-year-olds who are eligible have received their booster dose, as compared to 67.2% in the highest quartile. So that's a little bit over a 10% difference between the quartiles. Looking by race ethnicity, we can see disparities among eligible 65+-year-olds with a booster dose. For instance, when we look at white non-Hispanic, over 65% of eligible 65+-year-olds have received a booster dose, as compared to just over 50% of Latinx, and is similar for Black African-American residents. Looking at our current status on the ABAHO metrics for lifting the indoor mask mandate, the first criteria, CDC transmission levels of less than 50 cases per week per 100,000. So that's the yellow tier of the CDC. We are not currently meeting this metric. We have a little bit over 81 cases per week. We are in the orange level of transmission for CDC, which is substantial transmission, we would need to be in the yellow level of transmission, so having less than 50 cases per week, which translates to less than 7 cases per day, roughly, per 100,000, using the metrics we normally refer to. We would need to stay at that level for 21 consecutive days to meet this criteria. Looking at low and stable hospitalizations, this criteria is met through consultation with our hospital partners and monitoring multiple hospital metrics closely. Currently, while our hospitalizations are relatively stable, around 20 or so hospitalizations per day, they're not as low as we would like to see them. Hospitals also are experiencing some intermittent staffing concerns and do have higher overall hospital census with both COVID and non-COVID patients this year as compared to last year. So they have the potential to become overwhelmed more easily should we see a surge in hospitalizations. This third criteria can be met in 2 different ways. So the first way we'll look at is fully vaccinating at least 80% of our total population. So that's everyone 0+. Currently, that is not met. We're at 70.8% of our population 0+ fully vaccinated. The other way that we could meet this criteria, however, is to wait at least 8 weeks after 5 to 11-year-olds become vaccine eligible. We have not quite reached that point yet. We're at 4.5, almost 5 weeks since approval. And now I'm going to turn it over to Paul Gullickson to discuss these last slides.
Thank you, Kate. Yeah, we often are asked what we are doing in addition to hosting these forums to get out accurate information about the virus and the opportunities for the public to get vaccinated or tested or take advantage of other resources and to be aware of protocols. And so I just want to take a few minutes to offer a quick snapshot of where we are in our COVID communications and outreach plan for 2021 and talk about a little bit about where we are heading into 2022. As this slide shows, we offer a variety of different flyers and communications tools. These are just some of the examples of the many print and digital ads and social media posts that have gone out this year in both English and Spanish. All told, we have pushed out more than 1,750 items over the course of the year since January. In the past few weeks, we've transitioned from our Say Yes vaccine marketing campaign to one focused on encouraging pediatric vaccinations, such as this public service announcement on the right. And ads more recent are focusing on encouraging residents to give families the gift of safety this holiday season by getting a vaccine. That's like this ad up in the upper left-hand corner. Kate, if you want to go to the next slide. Yeah, this one's a little challenging to read, but it offers a more detailed breakdown of the marketing and outreach materials that have gone out this year in our efforts to get information out about COVID and the mitigations in place. And also just to let people know about, vaccination clinics, testing sites, town hall meetings, and other events. All told, our outreach has included 56 different media print ads, 34 testimonial videos, more than 1,000 flyers and posters, nearly 500 social media posts, and more than 75 press releases concerning COVID, which we have put out in both English and Spanish, bringing the total to more than 150 communications messaging in that area. And if you want to go to the next slide. And this is a further breakdown of just one of our digital platforms, that of Facebook, where many of you are watching this right now, where our impressions and engagements over COVID continue to be high due to the abundance of our social media posts, as well as our weekly COVID live stream, these live stream webinars. We've hosted about 70 of these community briefings over the course of the year so far. In September, we also began sharing the information offered during these Wednesday briefings in the Spanish language only presentation on Thursday afternoons. And our viewership and engagement with those presentations have been very encouraging. Average viewers of our English briefings in English, these Wednesday briefings over the past 3 months is about 10,000, with 1,500 of those viewers engaging in some way, such as sharing the post, liking it, or leaving a comment or a question. Average viewers for our Spanish only briefings has been around 6,000 viewers, with 500 engaging with it in some way, such as, like I said, liking it or sharing it in some way. Those continue to remain high, and we encourage people to share these opportunities to get information. In addition, I should add, members of the communication team have produced 27 Spanish language radio public service announcements and 5 monthly Indigenous language public service announcements, which have been aired many times on multiple local radio stations. In addition, they've taken part in nearly 90 interviews in Spanish language radio and 22 interviews on Spanish language television, including Telemundo and Televisión. Finally, they've also participated in other community briefings, including charlas, as well as special programs at clinics and other venues. So anyway, our plan for 2020 has been to continue with all of these efforts and all of these communication platforms, at least through January, with the expectation that these efforts would begin to taper perhaps in February, as with the hope that vaccinations would continue to rise with the pediatric campaign and booster campaigns, and that the case rates would wane as we head into spring. That remains our plan, although we too are concerned about what we don't know about the Omicron variant and what impact that virus may play in prolonging our communication outreach needs. We will continue to evaluate that, and as we learn more, and as we have been, pivot when necessary. So we will keep you posted on that. But that is the end of our report. So at this point, I'd like to go to Dr. Irma Lashendi, our vaccine chief, and she can give us a little update on our vaccination campaign and our work with the schools in particular. Dr. Shendi?
Thanks, Paul. So our vaccination campaign continues to make great progress. As of today, more than 26% of the 37,000 children between ages 5 to 11 have received their first dose. And as Paul mentioned, a number of them have started to receive their second dose as well. We've been working with the Sonoma County Office of Education to stand up more than 40 vaccine clinics at local schools to serve people who do not have convenient access or affordable access to healthcare providers. We're giving top priority to schools in areas with high rates of recent COVID infections, low vaccine rates, large numbers of English language learners. If there isn't a clinic at your school, you can get the COVID vaccine from your doctor or a local pharmacy. We will also be setting up more clinics during the months of January and February. Some of the upcoming clinics through Sonoma County Office of Education include Thursday at Shepherd Accelerated School in Santa Rosa from 2:30 to 5:30, Brookhaven School in Sebastopol from 1:30 to 5:30, and Adele Harrison Middle School in Sonoma from 4 to 6. These will all take place tomorrow. On Friday at Steel Lane School in Santa Rosa from 1 to 4, and on Monday at El Verano School in Sonoma from 4 to 6 p.m. You can see the full list at SoCo Emergency/Vaccine. The school clinics will be on a break from December 18th until January 3rd for winter break. Wherever you go, the vaccine will be available at no cost to you or to your children. Doses for teens and adults seeking their first or second shot, as well as boosters, will be available, so everyone in the family 5 and older can get vaccinated at the same time. Our total vaccine rate, which includes every resident aged 0 and up, continues to inch upward. As of today, 71% of our population is fully vaccinated, and 81% has received at least 1 dose. For those who have been fully vaccinated, please do get a booster shot. We're still not sure what the new variant will do this winter, but the safest thing you can do is to get fully vaccinated and boosted. if you are eligible at this time. Boosters are now available to anyone over the age of 18 as long as it has been 6 months since they received their second dose of Pfizer or Moderna, or at least 2 months for those who received the one-shot J&J vaccine. These boosters are especially critical for people who are 65 and older and people with chronic conditions. You can find information about local vaccine clinics and how to make an appointment at socoemergency.org/vaccine. I look forward to answering your questions, and I'll turn it over now back to Paul, our communications manager. Paul?
Thank you, Dr. Shindy. As always, and thank you all for this important information. As always, we encourage people to send their questions to publicaffairs@sonoma-county.org. That's public affairs, one word, @sonoma-county.org. And we will be happy to address your questions. That is our COVID update for today, Wednesday, December 8th. I thank all of our panelists for being here and sharing this important information. I also like to thank our crew who helped put this together, particularly Madi, our Spanish interpreter, and Elizabeth, our ASL interpreter. Tomorrow, we will be streaming a recorded version of this briefing in Spanish language only on our Facebook page. And we will be having another COVID community update soon. We will keep you posted. Until then, have a good week, everybody, and stay safe.